Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I'm joined by author and Dr. Sarah Matt. Welcome.
Thank you, Rose. I'm really glad to be here.
I think your dog's glad to be there too. But Happy New Year. We're
Thank you.
recording this right after the New Year, so it's a great way to get started. You have a new book that's come out that's on one of my favorite topics. But I didn't find you. You found me. So, um, would you like to share how we met and what
Absolutely.
what made
So
you reach out?
I actually saw your post about going to the gym. And I was
Mhm.
like, Rosa, I feel you because I've been watching you before, trying to see what was going on with the nursing world because it matters to me deeply. And I was like, now's the time to reach out to Rosa Hart. And so I did. And I'm so glad that we got together because it has been wonderful getting to know.
It has. It has. So, that was a really challenging post for me because I posted it on Instagram and TikTok a couple of days before I posted it on LinkedIn. I was really hesitant to because I try to stay more polished on LinkedIn and looking professional. And this was something about a patient when I was rounding had asked me if I was pregnant. And my answer was 9 years ago. And just talking about how that could have been like a deterrent to go to the gym. But I was like, well, I guess I really need to go. So I'm going to make myself go. And if I hadn't posted that, you and I wouldn't have met and found our synchronicity. So
Exactly.
just goes to show, don't let fear hold you back. Just be your authentic self so that you can find your people and they can find you, right? So
And
tell us more.
especially today, especially with all the social media and things like that, I think
Mhm.
the authenticity is so vitally important because there's so many personalities out there,
Mm,
but you and I, as an example, it's just us.
yeah,
It's
it's
just us. And I really like that.
yeah, and then it's not AI, right? You hope. Anyway, I don't know, it's getting good. But, tell us some more, Sarah, about your book and, like, what led you to your journey of, from being a doctor to working more in technology.
Sure. So, from a career standpoint, I started as a general surgeon, my fellowships in burns, but I realized really early that I was kind of confined at the bedside. In surgery, people are dying every day. Ultimately, you can see maybe 20 quality patients every day. I mean, it could be 40 if it's crazy. But I felt like I could scale myself, and I felt like I had different skills than some of the other docs. And during my research slash clinical fellowship, it really became apparent as I wrote grants, as I did complex experimentation. These are things that some of my colleagues really hated, and I was really good at them and I enjoyed them. And so I thought, how could I scale myself? How could I impact hundreds, thousands, millions, or more every single day? So for me, it wasn't at the bedside. And that's what got me to move into the tech sector. So I've been at places big and small. I've done several startups, had some fun exits, been at mid-sized places like Next Gen Healthcare, but then I spent a really great amount of time at Oracle Health. So I was there building out our OCI cloud business for healthcare and life sciences and actually got to be a big part of acquiring Cerner. So I went from being pretty much the only doc at Oracle to having 26,000 new best friends. So a big transformation like that is pretty crazy and pretty exciting. But once you've reached that scale, what do you do next? I went back to startups. So my last startup was Savado. They're Santa Barbara based. They're still chugging along, doing great, and they're focused on remote robotic surgery. Now, my book just came out in December and it reached national bestseller 2 weeks in a row, which is pretty amazing. Pretty excited about
Fantastic.
that. And I actually started it around this time last year.
Oh,
So at the end of 24, Wiley came to me and said, "Hey, we want you to write a book in healthcare." I was like, "Me? Okay. What do you want me to write about?" And they said, "Well, what do you think is the most impactful?" And so, we're in a very highly polarized time right now, especially in the United States. And I was thinking, what could I talk about that would be super impactful and could bring people together in this polarized time? And every single person has a story about healthcare access for themselves, their parents, their kids, their friends. And so access is a problem universally. And
mhm.
so that's what I dug into. And so this summer, I started really making that push to launch the book. And I'll tell you, it has been really exciting to talk to so many people about healthcare access and the impact it's making just in those conversations. Just having the book, having just come out, has been really astonishing. So I feel like I'm starting that ripple effect, and that if everyone does one little thing to improve healthcare access, we're going to have a tidal wave this year.
So what are you thinking of when you said, it was astonishing?
Well, I knew that it was an important topic. And I knew that when I think about technology improving access to care, that it makes logical sense and that it's definitely moving in that direction. But I think what really astonished me was it's not just doctors or technologists, it's nurses, it's adult nonfiction readers. It's lots of different people in policy, in, you know, non-healthcare tech, like all different places that are really thinking about this and considering it from a strategy perspective, from a business perspective, product
Mhm.
management. Oh, how does this actually impact my physical therapists? And so I think that people are taking the lessons I put in there and applying them to different areas that I hadn't really dug into as much as I could have, and I'm excited about that.
That is so awesome. You're expanding the conversation, and that really does need to happen because we talk about working on a multidisciplinary team with all the different stakeholders and experts, and we don't always have the same lingo, right? And so I think books like that and podcasts can help facilitate learning the lingo and how we can better communicate so that we can work together towards those common goals that, like you said, we all have a story about impeded healthcare access.
Yes, we
Mm.
do.
And maybe people feel like, "Oh, well, my doctor's office is just screwed up. They can't handle
But don't
this."
worry, they're all messed up.
They
So it's
are!
this, they all are messed up.
I mean, we are all having technical difficulties for sure. My mom was telling me about some that she was having at a new doctor's office that my dad's been going to with no issue, but they got a new system. And she's had all these issues with them just learning their new system. And I'm like, "Oh, that sounds so familiar. This is what I help patients with every day."
Yep.
You know? So it's everywhere. Um, so are you going around and, like, speaking as well, or are you mostly working with your startups during the week while people are
So
reading?
before the book came out, I did a pre-launch book tour, and so I did several conferences, went to several organizations to speak to their teams and things of that sort. And I'm doing a lot of that in 26 too. So I'm already booking into Q2, and I'm flying this next week to go speak to a big organization for their 2026 kickoff. And it's exciting to be able to bring healthcare access and how technology can decrease barriers to care to tech organizations,
Mm.
to hospitals, to clinical teams, to technical teams, and beyond. And so I do a ton of speaking. I also do fractional C suite and consultancy. Um, and those projects are very varied. But, you know, I like to do a lot of different pieces of the puzzle because it's an ecosystem. And ultimately, fixing the system isn't just one thing.
No.
And so while I advise startups, I think healthcare access can really be utilized as a differentiator and good for your business. When I address healthcare systems, I really think that being able to improve access is great for nurses. It empowers them and engages them in a different way with patients and helps with retention. So, no matter which area of the ecosystem you're part of, this topic, I feel, really can speak to the members of your organization.
How do you see that for nurses specifically?
Right now, as you know, retention is very difficult. We have huge levels of burnout amongst doctors, nurses,
Yeah,
everybody in the healthcare system.
sure.
It's not particularly glamorous at the moment.
Right.
But a lot of that comes with feeling like they don't have control and they can't make a difference.
Mhm.
So when we think about the standards of care, you got to stay in your lane, unfortunately or fortunately. It's good for safety, but it might feel like you're kind of on a conveyor belt, just doing the motions. But when it comes to healthcare access, a lot of that stuff's not in the standard of care. A lot of that is working with families, bringing
Mm.
the social worker in early. A lot
Yeah.
of that's considering other things that can be done to help a patient understand better, make
Mhm.
sure their follow up happens. And I think that those are the things where there's no great checkbox in your EMR. There's no great piece that you can just say, oh, I did it. I'm compliant
Well,
because these
I
are
would like
interesting.
to push back on that. There are
Do it.
checkboxes. You can press that check mark, and guess what? It doesn't mean anything happens.
Exactly. Sorry, I just rolled my eyes so hard, but the check boxes and how the patient feels or their family feels are sometimes very different.
Exactly. And just because you sent out a magic referral to something doesn't mean that that place called the patient or that that patient who, in my case, working with stroke patients, has aphasia. They can't even talk on the phone. It's like if you don't get them set up with things before they leave, how is it going to be communicated after the fact? So, to your point, it's so important to facilitate better communication as efficiently as possible because, yeah, it's not just about checking boxes. That's not gonna fix the problem.
And again, oh, did you send your patient home with discharge instructions? Yes, but did they understand it? And that's something that as practitioners, we can assist with on discharge. We can sit there with them and help them understand. We can let their children, family members, etc., understand with them,
Right.
but that's not a checkbox. And
Okay.
so these are things that can be done to improve access, understanding, knowledge, and trust that may not be part of your checklist, but actually give you power, give you that level of engagement that fills your cup too, because you're doing an amazing thing for real patients.
Exactly, and you cannot pay nurses enough to stay in places where they feel like they're not maybe doing more harm than good because they know that these hypothetical solutions exist, but they don't have the time in their
Mhm.
busy schedule to facilitate all of those conversations and do all that follow-up. I used to do a lot of phone calling of, family members to try to establish, who the person was that was gonna be making decisions for this patient when they left the hospital, and I remember somebody asking me this was when I was, like, working in the ICU, right? So I'm supposed to be keeping them alive and everything, and sure, they were getting ready to discharge, but I was like, "This person can't communicate on their own behalf, like, we have to have a person who's responsible for them, otherwise it's just not safe," and no, that wasn't part of my role, but I could see the long-term implications of that lack of communication, and that person's gonna end up back there if they live to end up back there. So,
And
it's
that
so
hits the bottom line actually for a hospital. So we think about length of stay, we think about 30-day, clawback, we think about all those patient satisfaction scores that now are vitally important to a hospital system. These are the pieces where the staff can make a huge impact just by asking a couple more questions, just by helping someone understand that actually are going to be increasing revenue, increasing reimbursement, doing things for the system that it can't do by itself.
so what are some solutions that either you've supplied in your book or you've learned in your conversations along the way that you feel like can make that more doable?
Well, I think we have to be honest with ourselves. First of all, we have an aging population. There's not enough human beings to take care of this population. We have to use tools. We have to. But the trick is find the right ones,
Mhm.
making sure they work for your population and for your system. So, regardless if it's the latest and greatest AI, a communication tool, you name it, I don't care what the tool is. It can't be brought into a system without the right stakeholders. Now, yes, you're going to have to ask the CFO or the CMIO or the CNIO, of course, but who are the real users? And from a product management perspective, I think this is vitally important. Is this something that actually the patients and their families are using, like a patient portal or some other consumer facing device? In that case, I'm sure we all have great opinions. We should probably talk to those communities that are actually going to be using the device or the system. If we're
Mhm.
making something to help nurses with their workflow, it's probably a good idea to talk to nurses. And as you know, one nurse is not all nurses. And ICU nurses are not the same as L&D nurses. They have different jobs with different workflows and different needs. So you have to be aware of that and make sure you're talking to the right people. These are important stakeholders. And if they can get into this process at the beginning, help identify what's really needed as opposed to what you think is needed, they'll also feel more bought in. And then the whole implementation will take a lot less time, a lot less friction. So, whatever it is, start slow, pick one spot at a time, identify who the actual users are, and then really talk to
That's so wise. And and yes, I do think we should have more nurses involved in this process. A lot of them might feel like, "Oh, that's not my lane. I don't work in technology." But nurses have the expertise of their experience, and they may think that what they see every day is common sense, and they don't understand how these other people building this technology just don't have common sense. But it's because it's not common. It's expertise. And that's what I talk about in my book, Speak Up, Start Now, that is also now out and an Audible bestseller. So I hope that throughout all this conversation and communication, we'll be able to come up with better solutions together. So, as we're building better leadership as colleagues, we have some competition that tries to come up to the surface and say, we get to make these decisions because we're in charge. Like, and there's this hierarchy of like physicians versus nurse practitioners. But, like you said, we've got everybody leaving. We have more people leaving than we have coming in for various reasons. So while we are here and while we are serving patients, how do you think we can best work together and not get caught up in like turf wars, but really focus on serving the mission that is the patient?
Well, I think that's the trick is doing what's right for the patient. And if everyone's doing what's right for the patient, it'll probably work out just fine. But we have to remember too that everyone's incentivized in different ways. So the compensation for nursing is different than the compensation for administrators, for physicians, for primary care versus surgeons. And so
Right.
everyone's being incentivized to do things differently. And everyone's just a human being trying to make it through the day. So if we can understand a little bit better how people are being pushed to do certain things, then we can understand a little bit better why that might be the case. So this is where your CMIO, your CNIO, all the different leaders within the spaces can really come together at different levels and say, hey, I know all about nursing. I'm a nurse. I'm not a nurse. You're a nurse. But
I,
you understand what I'm saying. They can give the expertise there and then work with their colleague, the CMIO as an example, to compare and contrast in a collegial manner and say,
yeah,
hey, how is this working for everyone? How can we have this be a win win? Now, if you're having, floor nurses and doctors kind of getting into rough and tumble from a friction perspective, that's not helping anybody. And neither of those individuals have the power to make some of those decisions anyway. But it's probably because things aren't being communicated great. So transparent communication is key. Everyone deserves it because they have to do the job. So ultimately, when we're making these big changes, if people feel like things are being done to them as opposed to them being a part of it, doesn't matter if they're a phlebotomist, a pharmacist, a doctor, a nurse, a front end booking specialist, whatever it is, if you want everyone on board, you got to bring them in early.
yeah, exactly. And make sure that they know that they have a voice and they're being heard. Yeah.
Mhm.
And that's that emotional intelligence and people skills.
But I mean,
So,
the thing is, though, it's still a hospital system. It still is a business. So, yes, everyone might be heard, but a decision's going to be made. And it might not be one everyone loves. But
yeah.
if they feel heard, most of the time they'll get on board.
Yeah, because at least they'll know that that perspective was taken into account, you would
I
hope.
agree.
Exactly. So this brings us to my $1 billion question. You're obviously accustomed to looking at big numbers. So I can't wait to hear your answer. So, Sarah, if you were given a grant for $1 billion to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
For me, the answer is very easy. I would eliminate medical debt.
Okay.
So, right now in the United States, a huge proportion of folks have medical debt, not just credit card debt or student loans, medical debt. And it makes a difference between paying for rent and medical debt, buying food, medical debt, buying medicines and medical debt. It's preventing people from getting more education. It's preventing people from doing a lot of things that could be
Mhm.
healthier. So when we have to make decisions about, am I going to get better and pay for this procedure or feed my family? That gets really, really difficult. So for me, the medical debt issue is something that if I had $1 billion, I don't even know how far it would go in the United States to get rid of medical debt.
Maybe we should
So
look that up.
we might. So I think I'd at least start there because if people are starting from a fresh place where they're not burdened by that financial aspect of it, I think it might allow people to learn, grow, be able to have the ability to make healthier choices and to be more proactive about their health.
Yeah. All right. I'm asking Gemini, what is the dollar amount of medical debt in the United States? For most recent estimate, $220 billion.
All right. Well, my $1 billion didn't go very far, but
But maybe it could create a process to start a snowball effect, right?
it's a huge amount and that's impacting everyone in some way.
Yes. So I mean, I really think that efforts like what Mark Cuban's doing with cost plus drugs and his new cost plus wellness and just pushing for price transparency, like what we've been talking about this whole time, the transparency in communication, the transparency in pricing can help people make those better informed decisions. And going from there, a lot of places are leaving the biggest um, health insurers that are dictating what care they will cover, period, and going for more like private plans or those, what are they called? Co op plans? Is that what they're called?
I know what you mean. I know what you mean.
Yeah. In order to kind of prevent some of that and share it across. So I don't know. What would be the best way? Because maybe we could use the $1 billion to for lobbying purposes. Maybe it would go further towards getting a policy change that way. What do you think?
Well, policy change is slow. People need to eat today. So I think that helping real people today would still be well worth it. Would I love to have this be the start to that tidal wave I was talking about that would help inform policy that helps everybody,
Mhm.
regardless of geography, socioeconomic status, et cetera? Because I don't want to leave people behind. I want everyone to actually be able to live a healthy life.
Right.
So I think there's lots of different pieces there. Lobbying is tricky. Bringing policy to bear is tricky and it takes time. So does proactive healthcare.
Yeah,
So I think
exactly.
you could go in any direction. And unfortunately, there's no guaranteed path. But I'd hate to do nothing and just sit on that $1 billion.
Exactly. Well, and maybe you could do like a demo, like take it with one population group and say, we're going to eliminate medical debt up to a $1 billion for people who had this certain kind of expensive treatment or, and then kind of like just prove the use case and
I
how
think there's
impact.
lots of different ways we could do it for sure. Unfortunately, healthcare still needs to be paid for. I mean, we still have nurses and doctors and phlebotomists, et cetera, that need to be paid every day. We have operational costs.
Mhm.
So it's tricky. I think the transparent pricing will be very helpful so people can make informed decisions. But I definitely think that this is a problem that is going to impact all of us because when people can't get the care that they need, whether it's because they can't afford it, whether they can't get to it, what it means is that they're not able to do proactive things to remain healthy. Now,
Mhm.
what does that mean for me? Say I'm healthy and I'm like, I don't have medical debt. I'm great. I don't have medical problems. I'm also great. But what if I get RSV next week and need to be hospitalized?
Mhm.
If the ER is full because there's people going there for UTIs, for uncontrolled diabetes, you name it. There's no space for me. So, regardless if I have that medical debt or if I have those chronic conditions, I still will be impacted by the system. And I think that's something everyone needs to remember. Doesn't matter who you are, someday you're going to be a patient and you're going to need those facilities too. So, how can we make sure that people don't have to go there in an urgent fashion so everyone can get there when they need it?
Well, and I mean, there's so many times when a bad debt balance will prevent people from being seen for those routine preventative appointments too. They're like, well, you haven't paid the last 6 times you were here, so
Exactly.
you're fired from the practice essentially, and you can't be seen. And what if there aren't a lot of other options around? So, yeah. So
But
maybe
that's when
some
you end up with those untreated diabetics, those untreated hypertensive folks. Like these are things where inexpensive generic medications are very effective. Hey, that would be a lot cheaper than sending people to the emergency room when there's a real crisis.
exactly. I have been learning more about the family health centers that are different from the federally qualified health centers. Like they don't get insurance payments. It's like operated by volunteers and um so a lot of uninsured people can go there if they exist. So maybe you could use $1 billion to set up one of those clinics, you know?
Well, I work at one of those clinics now. I volunteer
You
my
did
time. I do in a night in New York at the Mary Rose Clinic. And
clinic. I love it.
yes, it's a wonderful place. We do internal medicine for the uninsured. And a night in New York has had a hard time. You know, they are post industrial. The economy has gone kind of downwards. It's very rural. So when I see patients there, it's a lot of poor whites, a lot of migrant workers sometimes, Amish, you name it. It's people that don't have insurance for lots of reasons.
Yeah.
And so I love practicing there because I don't have to worry about DME or RSUs or whatever the alphabet soup is of the day because I'm just going to go take care of patients and I'm going to practice on paper because it's a safety net and just treat people like it's almost concierge because I'm actually communicating with them and they can't get that care anywhere else because they have that debt, they have that loss of insurance, they have all these different things going on. So, yes, I agree. These are important, but unfortunately, they're necessary now to help
Right.
people get the care they need.
Yeah. That is amazing. I didn't even realize you were working at one of those clinics. I'm so glad that came up.
I have for a long time.
Thank you so much for your service in doing that. I know that has made a difference in so many people's lives. So thank you for doing that. So if people want to read your book and find it, can you share that with us?
Absolutely. So the book is called The Borderless Healthcare Revolution. It's available on Amazon, Barnes& and Noble, anywhere books are sold. And you can also contact me or look it up on drsarahmatt.com. I'd love to interact with your audience, Rosa. It sounds like a really great audience. And they can reach me right there from the website.
Yeah, and I hope we will cross paths at a conference in the
Oh,
upcoming
that
year.
would be fun for sure. Yes.
Would be. So, if you've enjoyed this episode with Dr. Sarah Matt, you can find her on LinkedIn. I'll have her link there in the show notes as well as her website. And then, if you would like to connect with me, I'm on LinkedIn or on all the social media platforms at Nurse Rosa Speaks. My book, Speak Up Start Now, is available on Audible and as an ebook on Amazon, just like Sarah there. And if you enjoy this episode, please like it and share it with someone that you feel like could get some value out of it. That's how we grow. And I'd love to see in the comments your thoughts on how we can make healthcare better. I'm interviewing all healthcare stakeholders, which is any human person who has ideas for solutions to make things better. So if you know someone who has an answer, please send it to me at my email, which is info@nurserosaspeaks.com. And I'll see you in the next episode.